Kerala chapter, I welcome you all for the 104th webinar session of Hope Series, Season 2. Today, as our speaker, we have Dr. Manish Yadav, homeopathic consultant from Mumbai, and he's a consultant at the THEOTHER Song Academy and has his own successful private practice at Mumbai. Very well known for his aspiring teachings among his students, his zeal to take challenging cases in homeopathy has taken him through the journey of getting trained under many stalwarts of homeopathy. He will be taking classes on cancer cases and Burnett's approach. I heartily welcome you, sir, to conduct this session.
Thank you, doctor. Thank you very much. I hope my voice is audible to all of you.
Yeah, it's clear, sir.
Okay, great. So I was just talking to doctor and he was saying that this is 104th session, if I'm not mistaken, 104 session, right?
Yes.
So that's really incredible, the work that all you people are doing, and also the patience and the perseverance the participants are showing and in attending and learning. That really shows your zeal to learn more and more and grow in your life. So let me start, and before I start, I want to show you something, and from there maybe we can begin. Okay. I hope my PPT is visible to all of you.
Yes, sir.
Yes, sir.
Okay. So the topic that has been given to me is talk about cancer cases generally and its approach. So rather I will divide this topic not in cancer cases, but rather your approach in pathological cases, where of course cancer is included, and also deep pathological cases, difficult cases, challenging cases. You can give any names, but the approach is always going to remain the same. So that is what we are going to discuss today. A very nice quote, I always look at it, he says that teaching is only demonstrating that it is possible, and learning is making it possible for yourself. So here, my dear friends, colleagues, I'm not here to teach you all anything. You all are very smart enough. What probably I'm going to do is that I'm going to just share you my experience, whatever I have learned from all my great mentors in my life, especially in the field of homeopathy. And those nuggets I'm going to share with all of you. When we start our practice, this is how our condition is. In fact, this was my condition when I started my practice. And as all homeopaths, I had a lot of zeal, and always my goal was that I need to be a practitioner who can actually solve difficult, challenging cases. And when you start your practice, there are some old methods, there are some new methods, there are some methods which are yet to be born. And this is a state that we all are always in, especially when we talk about approaching and managing difficult and challenging cases. That's what was my condition. So what is my experience and what I would like to tell you? You might have this slide, you might have many approaches. You should test every approach, you should check every approach, but ultimately you have to find your own path. Until you find your own path, the life is really going to be very difficult for you, especially in the field of homeopathy. Let's talk about disease. Of course, one of the pandemic, we are right now in the era of pandemic, and you know the condition, how it is outside. But even if you exclude this pandemic, there is a spectrum of disease that we all have to face. And it's not just few, but many cases, many different diseases we have to encounter. And the spectrum of disease is wide range. I hope some of senior practitioners might be here listening to me, and they would agree that the cases that they used to see 10, 12 years, 15 years, 20 years before, and the chronic cases that are coming now are more complicated and more difficult to resolve. Tony Robbins is one of the speakers whom I love listening to, and very nice thing he has said. If you really want to be successful, find someone who has achieved the results you want and copy whatever they do, and you'll achieve the same result. A very simple, rather humble formula. So Now, when I started my practice, let me give you my story first. As I told you that I had a zeal to work with difficult pathological cases, and that brought me uh, under lot of many great homeopaths, fortunately, and learn under them. But still, when I was learning in my initial years, I still saw a lot of failures, lot of difficulties, even in their own practices. But of course, as I went through it slowly and slowly, slowly and slowly, slowly and slowly, what happened is that I got connected to some of my mentors, generally who gave me a path and who gave me one. Uh, they actually introduced me to somebody who actually we all have some of our old pioneer. You have heard about Kent, you have heard about Boger, Bonniason, Pulford, Pierschmidt, Dunham. But you know what? There is one homeopathic doctor from our literatures who has actually worked on depathological cases, and he has published many books in that. So who was he? None other than James Crompton Burnett. Okay. Of course, some of you must have heard his names. Okay. I know some of you must have opened his book also. But he's the person who is not well understood in the homeopathic fraternity. That's the experience I got in my initial days. The reason is his books, when you read, you do not understand much because he has not given a system to it. He just elicits cases after cases after cases. Oh my God, so many cases, cured cases, and number of remedies he keeps writing down. But not even a single place he writes down why he gave this remedy, why he excluded the other remedy. And the problem with the homeopath is that we all want explanations, right? So understanding Burnett and his approaches has given me a new insight, and it has helped me immensely in my practice. So what am I going to do is that I'm going to lay down some of the experiences that I have learned from this, his documents and his literatures. And of course, some of my seniors, some of my gurus, the mentors who were following this, they have helped me to understand Burnett more closely. There's a very good introduction. In fact, somebody who gets interested after this talk, he'll get a list of books of Burnett's. So many times people ask me, where should I start? Which is the first book that I should read? My first answer to this is that you should start reading Burnett's Tumors. And Burnett's Tumor is a very important document, very important book to start raising if you really want to understand the psychology and the understanding of Burnett's brain, right? And how he used to think. I would just like to show you one paragraph, and just let's read this and see what he has to say. In his introduction of Burnett Tumors, he writes down, in my judgment, they may all be included in the word homeopathy. All means all the methods that you know, all the methods of homeopathic practice in the motherland, okay, in all ages. He says all can be included in the word homeopathy. But there are some who dispute this and say that treatment to be really homeopathic must be purely and solely according to the totality of symptoms. Well, I am bound to confess that I am not infrequently unable to cure tumors by choosing the remedies according to the totality of symptoms, as set forth in the provings of the remedies. If others can, he's challenging. Now he's challenging. He says, if others can, let them come forward with their clinical evidences, not theories. Let them come forward with their clinical evidences. And if their results are better than mine, I will sit at their feet. However, mine are better than theirs, then they let them sit at mine. So when I read this paragraph, I was thinking, my God, if this what he's writing, this paragraph shows lot of conviction in this personality, in his personality, that whatever he meant, he actually saw results and he was thoroughly convinced with it. And to give you more information about him, he was an allopathic doctor. And as far as you know, allopathic doctors turned homeopaths are really good. They really understand the science even sometimes better than us. So this was just to show you the personality, the persona that he carried, and the conviction that he had in his teachings and his clinical practice. So let us go ahead. So when we talk about Burnett's approach, what are the things that we need to understand? So my dear friends, I'm going to talk to you for maybe 1.5 hours rather, and it is not possible for me to explain you everything, but the only purpose, the only motto and only goal that I have in right now in the talk is to show you another way. You all know different ways, but to show you another way, like some people here, some physicians I know might be a senior practitioners, and as my my guru Dr. Sarkar, Sunilma Sarkar always says that clinicians know where the shoe is pinching. So clinicians, all the clinicians who are listening to me, they actually know where the shoe is pinching, where patient is not getting better, and all the problems of actual practice when you have to see huge number of patients and difficult pathological cases. When I mean difficult pathological cases, I also include difficult chronic stuck cases. Those are also difficult pathological cases according to me. So I'm going to give you a glimpse of certain facts I'm going to put in front of you. And of course, I will try to inspire you, motivate you so that you go on the journey of reading and understanding this approach. So what are the factors? What are the things that includes in Burnett's approach? And these are the certain things that you will learn and you have to understand if you really want to go ahead and treat difficult pathological cases. The first principle that he talks about is layers of remedies. We're going to talk about it in the next few minutes. So layers of remedies. Now what is layers of remedies? You must be knowing. Now step up potency, one remedy, then second remedy, third remedy, 4 remedies. Anti-miasmatic and intercurrents. Use of anti-miasmatics and intercurrent is a very important part and needs to be understood in this approach. Rather, I'm going to talk about it in a nutshell, and also I'm going to cite you certain books that you need to read, and you'll have some great revelations if you follow my advice. Organopathy is another term which is being introduced. Organopathy is another term that is being introduced in this, and that's what we're going to talk about. Acutes, the role of acutes in approach, in Burnett's approach or pathological cases. What is the role of handling acutes? Why a homeopath? Why a homeopath needs to be acquainted, very professional and thorough with managing acutes, iatrogenic diseases, drug-induced diseases. You're going to get a lot of patients who are going to have a lot of drug-induced diseases. They eat a lot of tablets and come to you. So that can become a great blockage in the case. And of course, the universal question of every seminar, every talk, sir, what should be the potency? So I will give you some points about that too. So let us go ahead. Layers of remedies. Let us talk about this. I hope you must have seen onion, right? Peeling of onion. My voice is cracking. Okay. Am I clear to all of you?
Sir, it will be their network issue.
Yeah, because you need to check your network. It's clear,
Yeah.
it's clear. Yeah, okay. Great. Layers of remedies.
It's individual problem, sir. You don't worry about it, okay? Okay, sir.
Okay, no, I'm getting chat messages, so I'm just watching that. Of course, you
No,
can
sir.
write.
If there is any problem, we will inform you, sir. Okay.
Okay, great. Thank you. So layers of remedies. This is a concept. Rather, a lot of people know about it. But when I started my practice, the concept that I was taught was single remedy, one dose. Do not touch the patient until he dies. This was the thing I was being told, and not to repeat, not to touch the patient. And I practiced on that for a long time. I got good results in some functional cases, some psychosomatic cases, nervous breakdown cases, but where the organ was damaged, where the tissue was damaged, where multiple organs were involved, I could really find that thing working. And the first thing that you find out when you read Burnett, he talks about layers of remedies. What does he say? He says that if you're treating a patient, difficult patient, you have to be ready and you have to break this barrier that one remedy is eternal for a patient. Sir George Withulkas also talks about layers of remedies, if somebody must have read his articles. So it's like peeling off onion. You give the one state is there, you treat that state, another state comes, another remedy, another remedy, another remedy, and slowly and steadily you will see that the real picture comes up. So we'll talk about that. So what I'm going to do is that I'll share you one case. Okay. So before going that, in layers of remedy, the thing that you need to understand and you need to keep in your mind, present predominant picture or present predominant state. Our job when the patient comes, the first thing that you need to keep in mind is present predominant picture is the thing that you need to treat. Let me cite you a case with example and make you understand a little bit more. This is a case of lady in her 60s came to me with a diagnosis of Oligodendroglioma. First visit, I went to a home and I had to see her. I thought maybe patient might talk and all, but I was not aware that she's bedridden. Okay. They just said she's serious. She's a case of Oligodendroglioma. So when I went there, what do I see? I see patient is semi-conscious, muttering, she's talking something, incoherent speech, she's talking something, nobody is able to understand, not even the family members, not even I. And I'm sitting there taking the case, I'm thinking, what should I ask? So in these cases, the most important thing that we have learned is objective symptoms, the importance of objective symptoms. So what I did is, I sat down there and I was listening to all the relatives, what they were talking, but my entire focus was on the patient. I was just looking at the patient and trying to see what she's doing, even in this semi-conscious state. Is she doing something? Can I get something? Okay. And you know what I got? That the patient was in semi-conscious, but she was continuously talking. The problem was nobody was able to understand what she's talking. So I kept an ear and I started listening to it very, very cautiously. What is it exactly she's talking? And you know what happened is, what I observed was she was continuously speaking something that was clear. On closer observation, I understood that she is speaking a sentence and she's repeating the same. She was saying something, but the thing was again and again, the same sentence was coming again and again. Later relatives, I asked them, relatives confirmed that this she does almost every day. She catches up one sentence and speaks continuously. So you have to hear clearly what she's saying. But it is actually one sentence. Suppose she has taken anything like, the wall ceiling is bad. Suppose she says, so wall ceiling is bad, wall ceiling is bad. The whole day she will continue the same sentence. Oh, I said, what is this? Where do I look for this? I went back and of course, great master, Kent. I always use Kent a lot. I use Kent a lot. Okay. So I went in Kent and I started searching. And then I got this rubric. Mind delirium repeats the same sentence and the remedy was camphor. There is only one remedy. There's only single remedy, camphor. Yeah, somebody said delirium repeating the same sentence, camphor. And I was so happy to listen to this. Okay. Sorry, I got distracted because of the chat message. Okay, no problem. I gave camphor, consciousness gained, but now things became more difficult. So now what happened? Now just keep a watch what is happening. Okay. And what am I doing? As I told you, layers of remedies that is there in my mind. So one state, second state, present predominant totality. That's what I'm looking for. Now the lady is conscious, but now another problem comes in, and that is consciousness gained, but now things become more difficult. Now what happened is that she does not sit at one place, keeps moving continuously day in and night until she gets tired and then she lies down and sleeps. Again, when she wakes up, she again starts walking continuous walking. She just did not sit on bed. People used to make her sit. She gets up, starts walking. Again sit, gets up, walks on. She's just walking the whole day. Again, this was a difficult thing, okay? It was extremely difficult for family members to stop her also. In a sense, it was a joint family, Gujarati family, joint family, big family. So they used to keep duty, right? 10 to 4 you sit, 4 to 6 you sit, that 2 hours shift they used to keep. 2-3 people they used to require to pull her down and make her sit. It was so difficult for family members to make her do what they wanted to do. So then what I did, I started looking in Kent, and another repertory that I use of very often, especially when I'm stuck, Nair repertory. And I found out this rubric. Again in delirium bed attempts to get out of it, and the remedy is zincum. Now zincum, very restless, doesn't want to remain at one place. But exact rubric I got that doesn't want to remain at bed. One. Second, I got delirium murmuring with desire to leave the bed. Again, bed. So zincum. And in Kent, I got this rubric. Delirium violent is restrained and calm with great difficulty. So if you see, the same thing was there. So she was not being able to get on the bed. Continuously, she is restless. She is walking. And another thing is difficult to restrain her. Full force they apply, then again she gets up. The next remedy, according to the picture, I gave zincum. So zincum metallicum, wonderful result. She became almost normal, started talking, started doing great things, eating, walking, talking on phone. And then suddenly what happened is that maybe after 3-4 weeks, I kept her on zincum. Again, I was called, said, doctor, maybe something again has happened. And this time I found out that eyes staring, she's looking up and she's just staring. No movement of the eyes, she's just staring the walls. Eyes turn upwards in a way, eyes also turns upwards sometimes. And there was automatic motion of one hand. I have a video of her where she is continuously moving her hand. This hand is continuously moving. And I remembered, Alan's keynote. I remembered this remedy through this involuntary movement of one arm and one leg. Of course, few of people know that. Helleborus. The remedy is Helleborus. Eyes turn upwards, vacant look, fixed glares, and then in Boric also you can find out automatic motion of one arm and one leg. So now what do? Should I keep her on zincum? No, I gave her Helleborus because the state has changed. So you can see the transition happening. Camphor, arouse her. Then zincum state came in. Very good with zincum. After that, Helleborus state came in. And in this sequence, I kept on following her. And these were some remedies which was required. Zincum, after Helleborus, zincum state again came in. So I gave zincum. Agaricus state came in. Belladonna state came in. Thuja I used as an intercurrent. When things were settled, I gave an antimiasmatic remedy, Thuja, because a lot of psychotic manifestations. And ultimately, again, zincum state came. So again, I gave the zincum. So this is what you'll find when you'll start reading Burnett. He cites a case and then he gives a lot of remedies. I gave this, I gave this, I gave this, I gave this, I gave this. And he beautifully writes down, don't ask me which remedy acted. Patient is cured of his disease. His tumor is gone. So I used to wonder why doesn't he write some indications? Why doesn't he do that? There are two reasons probably. I don't know what was going in his mind, but what I understand, there were two reasons. That the first reason is clinicians who have a lot of patients, who are busy in practice, they rarely write books. They don't have so much time to write books, number one. And second important thing, which I understand, he really wanted that homeopathic students should not get ready-made material. They should go and research. They should go and study. And that is the reason in many places he has not given the system of it. Because our generation wants everything ready-made. That's what he wanted to develop, the creative thinking of homeopathic doctors, probably. But this was a message, right? Okay. So now there are many cases we can cite, and the first philosophy that you keep in mind is layers of remedy. In that present predominant state, you keep looking for that. And of course, as the state comes, you treat another state, then another state, then another state. And of course, I'm going to talk about in between what you do, right? Importance of past and family history. When you will go through his literatures in many, many different books, he talks a lot about past history and family history. Rather, vaccinosis, there's a book called Vaccinosis, where he talks about Tuja as a vaccine remedy. Then also he talks a lot about family and past history. In fact, there is one more beautiful book. I think people know Burnett for Basilinum. A lot of people know for Basilinum, and they say that it was Burnett who introduced Basilinum. Yes, he introduced Basilinum. He proved it, and also he introduced it as a remedy for ringworm, the fungal diseases. He introduced it, and you will see a lot of practitioners use that even today in fungal cases. They give Basilinum. But to my astonishment, there are very few people who actually know why he said that Basilinum is a remedy for ringworm. There are very few people. They only feel that it was his specific. A lot of people want to know specific, but rather there is no specific in homeopathy. Remedies are given on indications. So I'll tell you a history what happened actually. In fact, you should read that book. So as Burnett was getting a lot of pathological cases, he got ringworm cases a lot. A lot of practitioners are there. They might be struggling with fungal cases, and they know how difficult it is to remove fungal cases. In fact, not only homeopaths, even allopaths, you go to any physician and you say, I have a fungal case, they'll say, please don't bring to me. It is so rigid and so difficult. So he was also getting a lot of ringworm patients and not good results. He was not having great results and struggling. And then whenever it is said that whenever you do not get answers in present, you always look for past. In any life situation, if you do not get answer now, what is happening now, look for past. Some mistake in past has happened, or some connection in the past might be there. Like investigators, how do they investigate? So he started investigating in patients the past history and family history, and he found out in many patients, tubercular history was very predominant. And on that basis, he gave Basilinum to a patient of ringworm who was having past history of tuberculosis. And patients started improving. So people started feeling that Basilinum is a specific remedy for ringworm. Rather, it was not a specific remedy for ringworm. Rather, Basilinum was prescribed on the understanding of past history of suffering of tuberculosis, family history, or even the past history. That is an importance of understanding past and family history. So when we take cases, okay, we are always taught that we need to look into the mindset, the mental symptoms and XYZ, but rarely people talk about understanding how to understand past history and family history. So Burnett talks about it a lot. And here the use of, once you understand that, use of intercurrent drugs, your anti-miasmatic or intercurrent drugs comes into picture. Past and family history also helps you to understand iatrogenic diseases. In my at the end of my topic, I'm going to talk about iatrogenic diseases. But what is iatrogenic disease? Diseases that are being formed because of drugs, allopathic drugs, like hormones, antibiotics, painkillers, a lot of painkillers. So there's a drug-induced disease which is formed. How to tackle it, that I'll be talking about it. So first, let us talk about intercurrent drugs, intercurrent and anti-miasmatics. Let me give you one case. Let me cite you one case. This is a case of a recalcitrant diabetic macular edema with nearly blindness. So this lady came to me and her one eye was completely blind. And there was another eye which was I think almost 80% vision was gone. 80% vision was gone. In that condition, she comes to us. So we took the case, and what we found out, snake features, snake remedies came in a lot. All the features of snake remedies, like acids and all those things. I'm not going to talk about the snake remedy features. It came in. So understanding that and understanding the pathophysiology about the eyes and everything, the remedy that we choose was Bothrops. So we gave Bothrops, and after giving Bothrops, she really responded in the sense her vision was improved, status quo became, damage was not happening, but there was a lot of fatty depositions on the eyes, which was not going. So what do we do? Of course, this is Bothrops, you can read from Boric, amaurosis, blindness, hemorrhage, retina, all those pathophysiology. So snake remedy and the pathology we matched, gave Bothrops. Then I went into his history, family history, and family and past history. Look at it. I will not read, just look at it. Oh my God, I was astonished to listen to this. Death by heart attack, uncle, father, elder brother, grandfather. Death by coma, mother. Death by stroke, three uncle. Death by cancer, sister. Looking at it, I found out, I thought maybe she's a package of diseases, and such bad diseases, right? So what does it teach us? That this lady has got syphilitic taint, syphilitic heritage, kind of, from generations. It is coming in the family, and she is born with that stigma, syphilitic stigma. So that's why, people get diabetes, but who gets blindness? There are so many diabetic patients. But why does this lady has to become blind? That was a question. And this was the answer. That the soil was dirty. She was born with the heritage of all these great syphilitic miasm. So now, what to do? So of course we gave Bothrops for a long time, and then to use anti-miasmatic remedy or intercurrent remedy, the best use is when patient is status quo. There is no symptoms coming down. Generally, the waves are calm enough. There is no symptoms as such. That is the best time in the follow-ups to use intercurrents. So these were the remedies which followed. Syphilinum. A lot of time I gave syphilinum. Then medurinum in between, because a lot of symptoms of medurinum also came in. Again syphilinum. Then followed by series of antisoric remedies. Antisoric means indicated remedies. She came with a lot of small complaints which we tackled, and the result. Okay, I thought somebody is talking. Okay. And the result that I got in her case, of course, I cannot get the eyes back, which is damaged, completely damaged, but her vision, her blindness stopped, fatty deposition stopped, edema stopped, and 3 years she's still with me. 3 years she was with me, and after 3 years she went to her allopathic doctor, and OCT they did the pressure, and they looked inside the eyes, because 3 years she hadn't come, and they were forcing her to take some injections. They were shocked. The doctor said, this could not happen. I don't know what you are doing. Whatever you're doing, continue doing. But this is 1% chance. 1% patients really come with this. And that is what has happened to you. So this is the thing about intercurrent remedies. Now, I'm not going to talk much about it, because the lecture is only to give you a glimpse of it. Rather, we can talk later sometime, or rather I'm going to show you a path also. I'm not going to, just leave with some snippets just like that. So when I talk about miasms, this is a great revelation for me and great understanding for me. And a lot of you must be looking at this slide, and you will agree with me, isn't it? Yeah. You agree with me? Sora means functional. Psychosis means growth and excess. Syphilis means destruction. Maybe in the chat message you can say yes, yes, yes. I can see few of them. Yeah. I hope you agree. Yeah. Yes, 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 yes. Great, great. Oh, everybody says yes. So, so now what I'm going to say you, what I'm going to talk to you, or whatever I'm going to say, please keep your hand on your heart and listen to me. This is a partial truth. This is not complete truth. Okay. So the, the concept that we have known that SORA is functional, psychosis is growth and excess, syphilis destruction, and then we are so relaxed. It's not that easy. It's mixed. Never, not even a single place, Dr. Hahnemann in his chronic disease wrote this thing, that SORA is functional, psychosis is excess or low, whatever they call it, and syphilis is for destruction. Rather, he said SORA to be multi-headed, hydra-headed, fundamental cause. The most dangerous of all the three miasms is SORA. Then how can you say it is functional? I'm not going to talk much about it. What I'm going to tell you is that please read. There are two books. There are two books that I want you to read. The first book is Chronic Disease. I know a lot of people feel sleepy after reading it. But if you're a zealous person and you really want to help the humanity, you have to read that book and understand what Hahnemann is saying. And the second book is Allen's miasm, right? I don't have it here. It's in another room. Okay. You can go on Amazon and you can get it. It's a black cover book. J.H. Allen's miasm, chronic miasm. Wonderful book, wonderful book. If you really read that, you will get a lot of concepts of yours about miasm will get clarified. You have a better understanding what exactly miasm is and how to look. I'm sorry to say you, all my friends, that our habit of not reading the old literatures has given a lot of permission to a lot of our so-called teachers to play with our minds and say whatever they want to say, because they know that the students will not read. Nobody is going to take that effort of going and opening the book. But I am here to challenge you. I'm here to challenge you. Yeah, J.H. Allen, chronic miasm. But I am here to challenge your thinking. Please go and read. And also do not believe in me also. Okay, you go and read whatever I'm saying and see if it is true for you. But I know what I'm saying. I know because I'm being practicing. My 80% of practice is based on these kinds of cases. And I'm really thankful to all my seniors, all my teachers, especially Dr. Sulinmar Sarkar, Dr. Gajanand Dhanepkar, Dr. Ashok Borkar. Wherever I go, whichever platform I am, I'm always going to thank them, because they're the people who actually showed me a path, because I was so disheartened and diverted, not understanding, but they showed me the path, how to go ahead and treat. And I'm so happy. And that's what I'm sharing with all of you. A lot of people are raising hands. I think if you don't raise hand, that's better, because maybe at the end we can talk, because when the pop-up message comes, I get distracted a little bit and I have got very less time to talk. Okay. Now we come to another point. So 2 points we discussed. One is layers of remedy. Second, we talked about the past history and family history, right? The third point, we're going to talk about organopathy. This is the term that you will hear a lot in Burnett's literatures. Also, on this basis is Boric Mater Medica written. When you read Boric, you not get great mental symptoms. You get organs affected. The diagnosis is written. The pathophysiology is written. Hughes' Pharmacodynamics is another book that you can read. Clark also talks a lot about organopathic remedies in his literature. So let us understand what is organopathy. As it looks from the sentence itself, pathy means science and organ. A science which is based on organ understanding the action on the organ and giving us kind of specific remedy into So to understand organopathy, Burnett talks about 3 points. Again, he talks about 3 points. What is that? So if you want to understand how does an organ function and what is the action of the remedy, 3 ways: the seat of action, the kind of action, and the range of action. So suppose I look for suppose Sionanthus, and I want to know organopathy of its, which organ and how it acts. He says 3 things, keep in mind. Seat means where does it act, which organs it affects, number 1. Kind of action, what is the kind of action? What is the physiological and pathological changes it causes? How part, right? And range of action, how long it goes. It spreads till what time period? 1 organ, 2 organ, 3 organ, how bad it can be. So first we'll talk about the seat of action. So seat of action, especially we'll talk about Paracelsus. The Paracelsus was the first guy who said like cures like. And he said seat of action is very important. And Paracelsus has had his understanding and the science that he followed. He basically talked about the organ and the remedy that is affecting the organ. That's it. Okay. After that, Rademacher came in. Rademacher principle is you can get some literature out of it. It's old science. Rademacher was a person who actually worked on Paracelsus method, and he worked and he termed the coin organopathy. And a lot of people, a lot of places you will find out Rademacherian therapy, Rademacher organotherapy, all these sentences, words you'll get. So Rademacher was a person who coined organopathy. So how is it different from homeopathy? There is one organopathy and there is one homeopathy. How is it different? So the difference only is in understanding the drugs. In homeopathy, we understand drugs in a different way. In organopathy, we understand drug in a different way. The drug knowledge. A homeopath understand a drug in a different way, different understanding, and an organopathic doctor will understand drug in a different fashion. So what is it? The organopathic doctor will look at sick individuals. He's sick, what disease he's having, XYZ, and depending on that, he gave this drug and it acted, okay. That's his analysis. Doctrine of signature, a lot of doctrine of signature, okay, he will look for. And there is a use of large doses in organopathy. What is homeopathy then? How does homeopathy work? The drug knowledge of homeopaths, drug proving. We understand drug, especially on drug proving. And we use minute dose. That is our philosophy. So what happened is that after a certain time, the practitioners of organopathy slowly and steadily adopted Hahnemannian drug proving. So it started with the old method, understanding the sick, the clinical experience. Somebody gave this remedy to that and the patient got better. So now give this remedy to that patient, for example. After that, they adopted drug proving of Hahnemannian, and slowly and steadily, organopathy became a part of homeopathy. So what is homeopathy that he writes? Burnett writes, homeopathy is nothing but organopathy plus something else. So homeopathy is amalgamation of organopathy and something else. Hence, when you will start reading drug provings, when you start reading Materia Medica, you get lot of insights, lot of knowledge about. The authors keep talking about organ affection, the sphere of action, right? Am I correct, right? If you read Farrington, if you read Clark, even Kent, a lot of people feel that Kent was a person who talked about mind symptom. again, it is a wrong, it's a misconception. He talked about mind symptoms, but in Materia Medica, just go open and randomly open 2-3 remedies in Kent's lectures rather, and see how much mind symptom he really talks about, how elaborately he talks about. He just talks about a general mind symptom, and then he talks about general sphere of action of the drug, physiological action. That's what he talks about. Go and read Kent's lesser writing. Look at his cases. Don't look at the philosophy. Look at his cases. In the back it is given. And you'll be astonished on what principles he practiced. And beautiful cures he has given. Bad cases like prolapse, cancer, tumor. Oh my God. But look at the way he practiced. What was the indication? So what is homeopathy in the terms? Organopathy plus something else. And what is something else? Something else is your modalities, your general symptoms, your particular symptoms, your concomitants, your mental symptoms. So rather, it started with organopathy, then homeopathy came in, XYZ, whatever the science is, but history is, but now in homeopathy, everything is amalgamated. Hence, you have books like Boger, you have books like Burnett, you have books like Woodbury, you have books like pharmacodynamics, Hughes pharmacodynamics. Why is this written? Why was that written? They are all homeopaths. But few people focused on organopathic and few people focus on other symptoms. So when you combine, you can have a deadly combination. And that is what Burnett always talks about. So we rather should not divide ourselves in our minds. Rather, we should conjoin both the things and understand the remedies in its different perspective. And if we are able to do that, definitely the future is bright. So we talked about seat. Now we seat of action. Now we talk about kind of action. Kind of action means how. So now when you're reading a remedy, suppose you open Boric and you start reading a remedy, the first question will come, seat of action, which organs it is affected. Second, in organ, what does it cause? Like, you will have a lot of remedies working on pancreas, a lot of remedies, iris, lot of remedy. I don't want to take the names, but every remedy, when you read the physiological symptoms, the quality of the kind of action it has on pancreas is different. Phosphorus also is there. Okay, you have iris also, you have iodine also, but all the three remedies, how it acts, the quality of action on pancreas is completely different. If you're really interested about knowing it more, Nair repertory, I'm just giving you some hints. If you can just use Nair repertory as reverse reference, you can go and type, of course you have software, you can just put pancreas in abdomen and you'll get all the rubrics of pancreas. Start reading the remedies and you will understand the symptoms, because Nair is a repertory, sorry, which talks, not gives one symptom, but it gives a sentence of a symptom. The rubric is actually a sentence. And in Nair, it is actually taken from herrings, directly from herring, and it is cut, copy, paste in a way. So better understanding, you can get Nair. I use Nair a lot for my study purpose. Remedy must not only affect the same part as a disease, but special elective affinity. But the symptoms of the drug and the symptoms of disease must be like one another. Okay. Like for example, some of the remedies like Cesium jumbo lenum. A lot of people use Cesium for, for diabetes. We give diabetes. But let me show you something. Let us look at this remedy. So it's a good diabetes remedy. Boric gives lot of mother tinctures, specific drugs. But as you know, in homeopathy, there is no specific. Even when you think of specific, there has to be some similarity. Let us go in Boric. Okay. Cesium. Let us go in Boric. And let us see this. Of course, he talks about blood sugar and all those things. No other remedy causes in so marked degree of diminution and disappearance of sugar in the urine. Okay, but he says in bold, prickly heat in the upper part of the body. So now, if you get a diabetic patient and he has got prickly heat, especially in the back part, upper part of the body.
The slide hasn't changed, sir.
It hasn't changed.
Yeah.
Okay. I have to stop and again share it. Okay. Yeah. I was not sharing my screen actually.
Okay.
Now you can see Boric.
Yes, sir.
Okay. So this is what is written in Boric. No other remedy causes marked diminution or degree of whatever in sugar. So it's a good remedy for diabetes, but And next line he writes, prickly heat in upper part of the body. Prickly heat, right? So it's good remedy for diabetes, but if you get a patient of diabetes with prickly heat in the especially upper part of the body, in the back or chest or somewhere or face something, it is going to create wonders. Okay. So again, I have to share. Okay. So as I do not have much time, but I'm just giving you some glimpses. So there are a lot of remedies like Schionanthus america, Schionanthus virginia, Schionanthus, Cardismer. Go and read. Now start reading. Lot of students ask me, sir, how to read mother tinctures? Tell me some books written on mother tincture. No mother tincture book. Boric Materematica is the only book that you have to read. Don't worry about other people's writing. Read the source books and develop the knack of reading. Develop a system of understanding. Seat of action, kind of action. In this process, if you understand the remedies, it will really gonna help you. Range of action. Now, what is range of action? Range of action is still what long area it can act. Let me make you understand with some example what he means about range of action. He says that just imagine that a person goes out and he gets chilled, chilled. And he gets chilled and he gets pneumonia. So he gets pneumonia, his lung tissues get damaged, and the body throws out some symptoms. The lung throws out some symptom. And maybe it is a symptom of phosphorus. Okay, whatever changes, tissue level, whatever happens, phosphorus. You give phosphorus, patient gets better. Right? That's what it is. That's how it happens. So you take the ailments you take the totality, you give the remedy, great. Patient gets better. Now, next patient comes to you. He also gets pneumonia, but his history is different. He got nail hit in the lungs. There's a nail which has got hit in the lung tissues, and the tissue changes in the lungs, and he gets pneumonia. And the fact is that the pneumonia symptoms exactly look like phosphorus. So you give phosphorus. What do you think? What will happen? What do you think? What will happen? Can somebody message on chat? I want to know the answer. What is going to happen? Okay, nobody's answering. Okay, yeah, there's one answer. Why can't I see the chat message? Okay, I can't see the chat message. Okay, so what is going to happen? Patient will feel better. Definitely it will feel better. But don't you think that the nail has to be removed from the lungs also? You have to remove the lungs. Sorry, you have to remove the nail from the lungs. Yes, so nail has to be removed in whatever way, right? And then of course phosphorus will act if the symptoms corroborate. But if you give phosphorus, the symptoms subside, but the nail is not removed. Do you think the patient will survive? The disease will be cured? No, it will not. So what do we understand with this is, there is always a nail. Nail means not physical nail, but nail is here typical of any material still persisting. Listen to this sentence very carefully. Nail is here typical of any material still persisting cause. It's a persisting cause such as weak heart, valvular disease, microbes which are settled somewhere. So your remedy is acting, your totality of remedy is acting. But because of the persistent cause, if you remember in Organon, he always talks about maintaining cause and fundamental cause. The maintaining cause, the persistent cause remains. You have to address that also. And many a times it happens that the remedy that we give in the nail scenario, the remedy acts till the level of tissue changes maybe, but it is sometimes difficult to go beyond that and affect the persistent cause. For example, if somebody is having a weak heart, you give XYZ remedy for his totality of symptom, everything, he gets better. He will come and tell you, oh doctor, I'm feeling much good, better. But you know his heart is weak. Don't you think you need to do something for his heart? And there comes the use of the mother tinctures. A lot of people ask when to use mother tinctures, when to use specific, when to use X potencies. So your organopathic remedy, maybe biochemic remedies will come in use of here. Microbes, let me give you an example. There are the remedies like pneumococcal. People use it, right? Remedy like bacillinum. So patient comes, he has tuberculosis or he has some lung affection. You give a remedy on totality, he feels better. But there are high chances that again and again he's getting tuberculosis. Again and again he's getting pneumonia or some lung infection. The beautiful remedy, maybe bacillinum is needed there. Why? Totality acted, yes, it acted. But it is not able to reach to that level where it can remove the persistent cause. The microbes that are stuck there, the virulence of the microbe. Another example, very simple example I will make you understand. A lot of people will again agree with me, the seniors. You get a child coming to you with a lot of sore throat, pain, tonsillitis, pain. You give belladonna, he feels better. You give heparsil, he feels better. You give epis, you give remedies on totality, he feels better. Again, he comes back. Then again you give, again he comes back. But the tendency does not go. And then you give streptococcinum. Have you used this remedy? You give streptococcinum. And after giving streptococcinum, the entire symptom goes away and never in his life he gets throat complaint. What is this? So it shows that the organism which has affected there, the virulence was very strong. So it threw out symptoms of other remedies, but the remedies could not reach range of action, right? Range. It could not reach streptococcinum, that virulence at that tissue level. So maybe you need to give a specific remedy, understanding the microbes, understanding the organ affinity, all that. So bacillinum, pneumococcinum, cactus, Cretaceous mother tincture, a lot of people use, right? We never understood why we use it. It is not a curative remedy, but it is a support remedy. Like you use the nutritional supplements, if there is a vitamin D deficiency, your homeopathic remedy will not cure it. You have to give sachets. If there is calcium deficit, if there's iron deficit, you have to give it, right? Yes. Of course, if the assimilation problem is there, she's taking a lot of iron tablets, calcium, but it is not absorbing, then you need homeopathic medicines. So in that terms, and another one, the persisting cause, which you have to tackle a lot, especially females. If you have female clients, patients, hormones. A lot of hormones today is being induced in our females. A lot of hormones. And you cannot stop it. Even how much ever you counsel, even your people will not listen. Your family members will not listen. So hormone, if a lot of hormones are taken, the patient comes to you, that could also be a block. That could also be a maintaining and persisting cause. How to tackle it? That's what we need to understand. Okay. So we have time. Okay. Chalo. So I will not rush. So I hope doctors, you all are able to understand what I'm telling you. I hope it's not going over your heads.
Yes, sir. Yes, sir. It's okay.
Mm-hmm. I know few things might be difficult to understand and digest for a lot of people, but slowly you'll understand it. Let me share you one case. Okay. This was a case which I saw with my mentor, Dr. Sonilmar Sarkar, and I was handling that patient. In fact, I was handling that patient, but I was not able to get exact relief. Okay. What was the case? The lady came to me with liver complaint. She had hepatitis, viral load, huge viral load, 10,000 units something. And we gave some remedies and she was doing much better. She was on the verge of liver transplant because high viral load. And we used a lot of remedies and her viral load came down. But it didn't come to normal, but from 10,000, I think it came to 4,000 or something. But then the lady used to come to me again and again. And so these were the things. No? She was having hepatitis C. She was having cirrhosis of liver, aphthous ulcer, and eruptions on the legs. So this lady used to come to me and I was knowing that liver is affected, cirrhosis is there, and hepatitis is there. I knew this. But patient used to come to me and then she used to talk about aphthous. Okay. So I used to take the totality because the remedy that we gave was not helping. So I used to take local totality and borax and murk and all those things. It used to reside for a while. Then she used to come and also talk about some eruptions, vesicular eruptions on the legs, like bubbles in the legs, lower legs. It used to be there. So I used to give that. Even sir was seeing sometime and he also gave a lot of remedy. 1 year passed like this. Okay. So patient is completely stable, no liver transplant, nothing is required. But in some follow-up, she said, and she came and said, doctor, more than the liver, now this ulcer and this eruption is troubling me. Can you not give me something which can remove this? And there, I don't know how, sir called me and said, Manish, give this remedy. Cornus circinata. I said, sir, Cornus circinata, I have never heard about it. He said, open boric and read. So I opened boric and see what is written there. Vesicular eruption associated with chronic liver disease or aphthous stomatitis. Exactly, isn't it? So vesicular eruption, she had. Liver, she had. Aphthous, she had. This is how you understand the specific remedy. Even in specific remedies, you look for keynotes. You look for seat of action, kind of action, range of action. And beautiful result with Cornus circinata. She was so relieved, her aphthous went down. Slowly, her vesicular eruption went down. One more example I'll share with you. The case of psoriasis. And psoriasis is so difficult to treat, very difficult. I was struggling with it a lot of time. I was struggling. Few times I also showed to sir. He also gave some remedy, but we were not able to help him. And 2, 3, maybe 2 years, 2.5 years passed by. He used to feel better. Then again, was, psoriasis, how it goes. But this guy used to come, and now this is the utility of follow-ups, because we are seeing him for a long time. And we were trying to see that there is there a pattern or there's a repetitive of symptoms. So in psoriasis, the repetitive symptom that he had or recurrent symptom that he used to tell again and again in every follow-up, he used to say, I get a lot of itching, and exfoliation, which is common. But he used to say that I get boils, I get a lot of boils, pus boils. So we used to think it is maybe common now in psoriasis. But he kept on seeing that in every follow-up. When I check my notes in all the follow-ups, every time he used to say, I get boils. So psoriasis, itching, boils. Psoriasis, itching, boils. Psoriasis, exfoliation, boils. And sir suggested me this remedy. He said, Manish, try this remedy now, ichthyolum. When I opened, see what is written. Psoriasis, itching, in bold it is written, itching, crops of boils, in bold, crops of boils, and psoriasis. So when you get crops of boils and itching is there, and with even eczema, psoriasis, all the pathophysiology, acne, rosacea, erysipelas, seat of action, kind of action, range of action. And you will not believe, with ichthyolum, her entire psoriasis went off. He got completely better. The only depigmentation remained in his body. And today, now it is more than 4 or 5 years. We have not given any remedy to it. So this is another understanding which I am sharing with you, which you will understand when you understand Burnett. And from there, you start reading Boric, pharmacology books, right? Like Hughes' Pharmacodynamics, and especially Boric and Clark. Boric, Clark, and Farrington. These 3 books are the gems to understand, right? Acute management. So let me talk about acute management. So now when you are working with difficult pathological cases, remember one thing very important is that you have to become a very good master in treating acutes, because in pathological cases, difficult cases, acutes are going to come in every follow-up. Maybe in every week they're going to call. My phone continuously is busy. You know why? Because I'm always talking to patients. What am I managing? Acutes. So anybody who wants to deal with pathological cases, he cannot run with acutes. And for acutes, you have to really look into it, right? Master. So let me show you one example. What happened? So acute is what? Acute is a way to look within economy without being prejudiced. In acutes, actually you get the state of the remedy. The actual state of the patient you get in acutes. There is no assumption, there is no prejudice in that. And many times acute actually reveals the real state. This is what I have seen. Acutes following the remedy given is also a good indication of the vitality. Means if you gave a remedy and acute comes, means that the vitality is good. The patient chances of getting him is better. So you treat the acute properly, maybe he will come out of the disease. So I'm sharing you one case. This is a case of, CA thyroid. He came with strong fear of cancer and death. I kept on taking his case, but I could not understand anything about him. Like very general and vague symptoms I got. He talked about anxiety about family, loves nature, brother had pancreatic cancer. So on that understanding, we gave carcinosin, few more symptoms were there. Not great relief. Then in another follow-up, he talked about maybe, he also talked about a strong grief and because he lost his brother and all the responsibilities came in. So Ignatia was given, nothing happened. Okay. Then we had no option. So we gave some, specific remedy, thyroid, which should not be given actually on the specific indication, but we were not able to help him. So we said, let us try organ affinity. Nothing happened. And then this patient used to keep calling me always. You know why? Of course for cancer, but also for his cough. He used to continuously call me and say, my cough is there, cough is there. So on phone, I used to give some remedies because he was far away, looking at the weather and all those things. And one day what I understood is that, oh my God, he's always calling me for acute. Why shouldn't I take his acute totality? And I called him in one of his acute. I said, you need to come to clinic and we need to talk. And I sat down and these were the symptoms I got. Oh, okay. Where is my repertory? Yeah, I think it got deleted actually. Okay. So sorry, I'm really sorry. Maybe the sheet got deleted. I'll tell you what were the symptoms. He gave very simple symptoms. Whatever modalities he gave, like lying down, dry cough in the night, I repertorized. And in that repertorization, I also put throat, thyroid, affections of thyroid, that rubric. And I started looking at all the remedies, the 10, 15 remedies which were there, lacases, cocculus, a lot of remedies were there. And then suddenly one remedy popped up and that was spongia. And it clicked to me, oh my God, spongia is a remedy for thyroid and he's getting cough. I started reading spongia. And if you read spongia, it's a great remedy for goiter, thyroid gland much enlarged. That's what is written in Fata. Beneficial in goiter, thyroid gland much enlarged, spells of suffocation, which is worse after midnight. That's what was happening with him. Whenever he used to lie down, he used to get suffocation and get up. Thyroid gland swollen, soreness of throat, XYZ. I gave spongia for his cough. Remember this. I gave spongia for his cough because his cough was troubling him. And you know what happened with spongia? The swelling of thyroid went off. Completely vanished. This is his report. No solid or cystic lesion seen in the present scan. And they said it is a diffuse. You can see here, it's a diffuse thyroid disease. My God. I was really baffled after this case because then I understood, oh my God, sometimes acutes, when a patient comes, we apply so much brains we use. This remedy, this dream, all this is important. But even after giving that, whatever constitutional remedy, whatever you call it, if patient calls in acute is the best chance to treat the patient. And that's what Burnett used to do. He never used to leave his patient in acutes. I know a lot of physicians talk about give a remedy, then don't touch the patient. Don't touch it. Oh my God. It's better he takes crocin, but he should not take any homeopathic remedy. You know why? Because my remedy, another remedy will disturb my original remedy. What rubbish. Sorry. That's not the way homeopathy works. You have to look at acutes. You have to look at acutes, and acutes, if you can really handle properly, it is going to give you immense pleasure and immense satisfaction in results, right? And also the patient confidence increases in you. Great. So we have got 15 minutes more. So great. So I hope whatever I'm talking is making a lot of sense to you. Okay. So we talked about layers of remedies. Then we talked about, in layers, we talked about present predominant symptom. Then we talked about intercurrents. Then we talked about all the organopathic system. Acutes we are talking about. And now we come to the last section, which I want, last or second last section, iatrogenic diseases. Now, what is iatrogenic disease? Iatrogenic disease is nothing but the disease which is being formed because of use of a lot of allopathic drugs. A lot of times it happens that you are giving constitutional remedy, maybe you're giving right indicated remedy, maybe anti-miasmatic right remedy, but still it is not moving. The case is not moving. You're not getting good result. Please look in the past, as I said in my previous slide, look in the past. If some drugs are being taken, some tablets have been taken, you need to nullify those effects. And we have potent medicines in homeopathy. Even in cancers, we use a lot of allopathic. This is what Sarkar sir has taught me, that use a lot of allopathic drugs homeopathically to treat chemotherapy side effects. So first case I will just narrate. Tarsal tumor is a child who came with a tarsal tumor. He was having a lot of swelling here, and you know tarsal tumor. So, okay, he was having tarsal tumor. A lot of swelling was there. Pus used to come, and it was recurrent. He was troubled, you know, for a long time. He was troubled. Mother was homeopath. She was giving remedy. He used to get better, not better. Then he came. I started treating him. Gave him a lot of indicated remedies, whichever I could feel, like, you know, pulsatilla, then ignatia, then silica, carcinosin. I was really frustrated. You know why? Because the child, 6-7 years of child, I was not able to help him. All the remedies that I was giving, nothing was helping. And there was a lot of pressure from family that get it operated, get it operated. And mother was asking, doctor, something will happen, something will happen. Then I went in the past history of child. I could not get anything. Then what I did is that I took mother and I said, you sit, I want to talk to you. Tell me your pregnancy history. And of course, in pregnancy history, we tend to talk a lot about mind symptoms and all those things, but I was not looking for that. I was looking for some blockage. And suddenly she says, while talking, she says, he's a special child, you know, doctor. I said, special child? What do you mean by that? He says, no, he has come with a lot of difficulty. I said, what do you mean by that? She said, oh, I was having a problem of infertility. And all the therapies I did, IUG and all those things, or all therapies I did, but nothing happened. Then we left it. And suddenly, after we left it, then he was born. I said, oh my God. Then you must have taken hormones also, right? Injections or tablets. He said, yeah, they give a lot of hormones. So I understood what? That mother took a lot of hormones, and after that the child came in, and the child passed through the canal, and hereditary, like the miasm that you talk about or whatever XYZ, the virulence of the hormones at the energy level, the dynamic level, remained in the patient, in the child. And hence that was the blockage, and hence the indicated remedy was not acting. So first we need to kill that virulence. And the remedy that I gave was Aristolochia clematitis. It's a wonderful remedy. You can read from Vermeulen. History of OC pills. Wherever you find history of hormones and OC pills, this is a remedy which can cut it down. I have got many cases where I have used Aristolochia a lot, especially in hormone patient who take a lot of hormone remedies. And this is very common with Indians. Worldwide, in fact, even the practice, especially females who come to you. But try to understand, he was a child, okay, 6 years. The virulence was there from mother. It passed on. This is what actually Hahnemann talked about when he talked about miasms and the inheritance, the taint, whatever he talked about. So maybe sometime later we can talk about miasms a lot, but the blockage was this. And Aristolochia, you will not believe, after giving Aristolochia, I've got her photos and images. Slowly and steadily, everything started improving. And from all the pus and tumor, everything went down. He got better. After maybe 2 weeks or 3 weeks, or maybe 1 week, 1 month, I don't remember much, but he got an acute attack, profuse diarrhea with podophyllum. He got better, and till now, more than 3-4 years, 5 years, not a single remedy has been given to the child, and no recurrence. Another case of ITP. I got this child from very remote place of Madhya Pradesh. Somebody said, go to Dr. Manish or something. I don't know how he came to me. And when he came, I had no history, no data. Why? Because the father came, mother was not there, and they were from a village. Okay. They came in, the remedy, lot of allopathic drugs were given. There was no data, no individuality I could elicit. But what I found out in the child was, he was moon face. Okay. A lot of swelling was there. And I asked, oh, why is he swollen like this? And I suspected maybe this is cortisone, moon face and all those things, like steroids side effect. So I saw the reports, I saw the medication, and in medication, a lot of steroids were used because it was said that this case could not be cured, and they used a lot of steroids and left him. And I gave cortisone, history of steroids. You cannot believe what change happened after that. After giving cortisone, homeopathic cortisone, okay, the patient got better, moon face swelling, everything reduced, his length increased, body increased, everything increased, his platelet counts went up, became normal, and no trouble right now. Of course, few more remedies I used later on, but cortisone really made a great change in that. Last case, this was a case of CA rectum. Again, old lady, not able to give symptoms. Marathi, she was speaking. She came with, I think her age was around 60 something. She talked a lot, but no clear, peculiar symptoms I could elicit where I could base my prescription. So I gave some remedies like Ignitia, Thuja, and XYZ, but nothing happened. The bleeding was there, and as she was old, the children were not willing to go for chemotherapy and XYZ because her constitution was really broken down. So remedies which I gave was not helping her. I gave Ruta, I gave Thuja, I gave Ignitia, a few more remedies, nothing helped. And then in the history, past history, if you remember past history and family history we talked about, I had noted her all past history. And somewhere she told me, the children told me that she's right now 64 or 65. Since the age of 22, she is being regularly consuming painkillers. Regularly. Whatever happens, she pops in a painkiller and she's fine. So I asked her, do you really do that? She said, yes. What to do in village? We have to work, we have to go in field. So whenever I get some trouble, I pop in. So she had a habit of popping all the painkillers and analgesics. And the remedy that I gave was natrum salicylate, aspirin derivative or something. So with that, I had no remedy I had to give. Why? Because the bleeding stopped, tumor went off. She's still fine. More than 6-8 years have passed. They still call me and take medicines. I have told them that no medicine is required. She's fine. But they still say that please give something. You know what I give? The best remedy in homeopathy, SL. I give them placebo every alternate month. They come and take 2-3 months medicine. But she's doing fine, right? So these are the understanding. These are some cases with examples I'm here to share with you. And definitely, I hope I have tried my level best to give you an overview, a big picture, so that it gives you a motivation so that you go out and study it. Potency. Very simple. I'll conclude it in 5 minutes so that nobody asks me potency question. Very simple. High susceptibility, high potency. What does it mean? What does it mean? High susceptibility means what? High susceptibility means when the symptom totality is very clear. You get good symptoms, good general symptoms, good modalities, clear-cut symptoms. Susceptibility is high potency. When you're confused, fact level cases, when the symptoms are not that much, modalities are not that much, general symptoms are not that much, you are confused whether this remedy, that remedy, keynote symptoms are not there, susceptibility is low, low potency. High potency means 1M, 10M, low potency generally is 30 to 100. If you want to use organopathic drugs, like an organopathy, low to mother tincture, 6x, 12x, okay, or mother tinctures. If you want to use, like I gave you example of Cornus circinata, ichthyolum, you can use it in a low potency, okay. Vitality is good and totality is easily available. Please always think of high potency. Even in pathological cases, I can show you many cases where 1M has not worked and 10M worked. Why? Because I never used to give high potencies in pathological cases, because I had learned that in pathology gives low potency, give low potency, give low potency. No, it's not like that. Low potency, vitality is low. If vitality is good, patient is throwing out good symptoms, keynote symptoms, good modalities, generals, go high potency and see the magic of high potency. You'll be astonished. Antimiasmatic, some people might have questioned that when you give a remedy as an antimiasmatic, we are intrusing like thuja, nitric acid, mercury and XYZ sulfur, always given high potency. 1M, 10M, maybe CM. Alan talks about in his book that give high potency. Why? Because when you're giving antimiasmatic and you want to touch the miasm is not superficial. It is from generations it is coming. So you have to give high jolt, because it's in depth, it is a deeper disease. So high potency works better with antimiasmatics. So at the end, let me summarize. And yes, 2-3 minutes are left. So let me summarize it. Layers of remedies, the first concept. Antimiasmatic and intercurrent remedies, organopathy, acutes, iatrogenic diseases, and potency. These are the things that you need to understand when, rather, let me not call it as a Burnett's approach, but let us call it as a general approach when you want to learn and you have to deal with a lot of difficult and pathological cases. Few points to remember, okay, even in dealing with this, because the science we do not have to leave, okay. Individuality, very important, very important. Even if you have seen the remedies that Cornus circinata, the ichthyolum, individuality was looked for. So even in mother tinctures, when you're reading mother tinctures or you're reading some specific remedies, you're reading biochemics, there is no specific in homeopathy. In that smaller remedies also, you have to find out the keynotes, individuality. Without individuality, no remedy is going to act. If patient is better and there are no new symptoms appear, don't be in haste to change the remedy. This is the biggest mistake that we do. I talked about layers of remedies. You will read Burnett, you will listen to me and listen to others, and you'll feel, okay, chalo, now we have to just keep changing the remedies. No, dear, no. Please go and read Hahnemann's Organon, where he talks about zigzag method. He talks about patient is better and no new symptoms. Please wait. Whatever symptoms, minor symptoms will go. Only give the remedy when the totality is changed or he comes with a troubled symptom. If patient's general health is better, he's feeling better, please wait and watch. Okay. Don't be in haste to change, because haste, repetition will damage your prescriptions and medicines. Paucity of progress. Symptoms indicate change of potency or intercurrent. If there's paucity, nothing is happening. Patient got better 25%, but after that he is not improving. Means what? Maybe you have to change the potency, or even if you have done that, maybe now the time has come when intercurrent has to be used to remove the blockages. Mental symptoms always precede the local symptoms and local symptoms in selection of remedies. So we are talking a lot about local symptoms. Remember, in the selection, if you get good keynote, remember, listen to me what I'm saying. When I say mental symptom means mental generals. Please read Kent's lesser writing and you'll understand all the general symptoms. Good mental general symptoms, the keynote mental symptoms. If that is clear, then maybe that thing should be used as an eliminating symptom to think about the remedy or differentiate the remedy. When I say mental symptom, it doesn't mean what it is called thematics. I'm not talking about thematics. I'm not talking about groups, your assumptions, your ideas. No, no, no. I'm talking about pure repertorial language, pure Cantanian method, general method, and keynote symptom in repertory if you get. That is mental symptom I'm talking about. Okay, so books.
Yes, sir. Yes, sir.
Books. The last slide is books which you need to read. Burnett's, Chronic Disease, Henneman's, Allen's Miasm. Very important book, Defective Illness by Pierre Schmidt. It will help you to deal with all the defective cases. Of course, MM Boric Clark Kent. And in repertory, Kent BBCR Clark. And for nosode, if somebody is more interested, you can also read Ghosh and Forbister. So if you want, you can take a photo of this, and yeah, it's a hard work, but dividend is very good in future.
Yes, sir. Yes, sir.
So, okay, one more thing is there, which I need to share it and then end it. There's a 12-day session advanced program coming in homeopathy by Other Song. So maybe you can enroll it, you can contact people, and these are the dates, 17th August to 31st August. Education continues. So you can, if somebody is interested to know more, you can go ahead with that. So,
yeah, I had shared it in my Telegram, sir. No problem.
So here I am ending, and thank you very much for inviting me and patient listening to you all of you. Thank you.
Thank you, sir. Sir, can we take one or two questions?
Yeah, you can.
We are out of time. If delegates have any doubts regarding any doubts, then we can spend 5 minutes more than for that.
Yeah, I think 5 minutes is enough.
Sir has explained everything so crystal clear, leaving us without even any doubts for it.
Okay. Fine.
Thank you very much.
Yeah. Let me see the chat box.
Okay.
Yeah.
Somebody is writing Subroto Miasmatic Prescribing. Yeah, that is also a very good book. Dr. Subroto Banerjee's Miasmatic. You can use that.
So somebody has asked when to consider organopathic medicines cases.
When to consider organopathic medicine is when you are dealing with tissue level changes. When organ is damaged, tissues are damaged, and that level you can use it.
And bacillinum and tuberculin and differences of preparation of them. Yeah.
Bacillinum and tuberculum, the simple difference is that tuberculinum is tuberculinum, okay, tuberculosis and tubercular bacilli. Bacillinum is actually taken from macerated lung, okay, the lung from that. So bacillinum has not only tubercular bacilli, but it also has other bacilli also. So bacillinum is more potent, in fact, than tuberculinum. So especially when to use it is if you get patients who have got a lot of lung infections. You know, patient comes to you and say, oh, I've been 2-3 times pneumonia, bronchitis, means lung is affected, lung is weak. Bacillinum will work more. And for tuberculinum, if just a general tuberculosis is there, or tubercular features, if you know, restlessness, all those, you know, want to go out and things like that, that you can use. Yeah.
Somebody has asked whether you consider this one second, sir. Thermals are considered or some.
If it is there, then I will no. It is predominant, then I will consider. Otherwise, no.
Yeah.
The patient says, "Oh, I'm very chilly," and of course, I'm not going to give him hot remedy.
Okay.
But if he's not saying anything, then I will not consider that. Okay, so
okay, sir.
that should be enough. Yeah.
Okay.
Yeah, before you leave, sir, I have to tell something after that thing. Actually, I'm following the sensation approach, and I think you haven't mentioned the two books. I wanted to refer 2 books more to the audiences. The Just You See by Sunil Kumar Sarkar and Role of Pathology Prescription by Ashok Borkar. Two definite wonderful books by Other Song Academy. Very good session, sir. Thanks a lot for bearing us. So I
Thank
request Dr. Rajeshri to officially give a gratitude of Aisha.
Okay, thank you, Dr. Deepu. Thank you, sir, for this excellent session. You motivated us to learn more and asked us not to limit our understanding of homeopathy just for single or single remedy, but also to learn and read, study organopathic medicines. Thank you, sir, for this excellent session. It was a pleasure to listen to you. Thank you, sir.
Thank you. Thank you very much. Okay then. Bye bye.
Thank you.
Take care.
Bye, good night.
Reach home safely. Means from your bedroom to your hall, reach home safely. Bye bye.